طيب خلونا نكمل مع ال platelet disorders. 37-year-old woman has come to see you because of epistaxis. The episodes have been recurrent and hard to control. She uses no medication. She has petechiae. Spleen is not palpable. Laboratory lab tests show normal APTT, normal INR, platelet of 27,000. What is the best initial therapy? So basically, what do we have here? We have a patient with petechiae and low platelet count, right? Everything else is normal. Okay, so petechiae due to low platelet. When you have low platelet, you get petechiae. So petechiae is a manifestation of thrombocytopenia. Type. So what is the diagnosis here? The diagnosis here is ITP. Type. How would you treat ITP? What's the best initial therapy? Is it steroids, IVIG, or NTD, rituximab, platelet transfusion, or observation? Okay. So the answer is going to be steroids. The best initial therapy for ITP is steroids. And the take-home message here, and if you have a platelet count below 30,000 طبعا أو إنه البيشنت عنده bleeding, then you will treat the ITB. In general, مش كل مرضى ال ITB you will treat. Not every ITB is treatable. Right? I mean, you don't treat every ITB. There's an indication. If you have a platelet count below 30,000 or the patient is bleeding, then you will treat. If the platelet count is more than 30 and there is no bleeding, just observe. تمام؟ طيب وبنيجي إلى إمتى أنت تعمل ترانسفيوجن؟ متى تعمل بلاد ترانسفيوجن؟ platelet transfusion إلى المرضى اللي عندهم إيش؟ ITB. So the same patient, what's the best initial test for the previous case? And then a patient with ITB, what's the best initial test? هتعمل CBC with peripheral smear، هتعمل bone marrow biopsy، هتعمل Combs test، PT, PTT. What will you do? So the answer is going to be A actually. Why? لأنه what is ATB? ITB. ITB is immune thrombocytopenic purpura. طيب الهول مارك تبع الاي تي بي عشان افكر في الاي تي بي you get isolated thrombocytopenia, isolated low platelet count. Everything looks normal انما you look at the platelet count تشوف انه platelet count is low. So كلمة isolated thrombocytopenia actually means you are dealing with ITB, right? So isolated, only the platelet count are low, only the platelet count is low, then you are dealing with what? You are dealing with ITB actually. طيب تمام. هتعمل bone marrow biopsy? No. If there is any another indication, then you will do bone marrow biopsy. Or let's suppose the patient is refractory to all treatment lines. طيب هتعمل Combs test؟ لا, useless. Why would you do the Combs test? PT, PTT ما لهم علاقة. Those for the coagulation pathway. Bleeding time, nobody does the bleeding time. Bleeding time is always wrong. طيب bleeding time is always wrong. طيب البون مارو biopsy you will do it if the patient is elderly or in refractory cases. طيب elderly is defined as more than 60. If you get a patient with ITB والانست تبع الاي تي بي في شخص عمره اكثر من 60، يعني let's suppose شخص عمره 66 وجاه اي تي بي، then you may think انه البون مارو is indicated لانه he's an elderly وجاي بنيو onset ITB. This might be as a consequence of another malignancy. طيب okay. Now, in refractory cases, you might also do what? Do a bone marrow biopsy. Otherwise, you will just do CBC with peripheral smear, right? طيب HIV-induced ITB, how would you treat? If you get an HIV patient وعنده ITB، لأنه ال ITB أحيانا تكون secondary لل HIV. The HIV can induce ITB actually. So how do you treat this patient? Will you give steroids, IVIG, NTD, plasmapheresis, and HAART? HAART يعني highly active antiretroviral therapy. طيب so the answer is going to be HAART. لماذا؟ يا جماعة in general the answer is always HAART. في HIV the answer is almost always HAART. If you see HAART in the options, then this is most likely the answer. طيب لماذا؟ لأنه طالما ال HIV هو اللي عامل ITB, what you do? You give the HAART اللي هو anti HIV medications. If you suppress the HIV, the ITB will improve, right? طيب now let's go and dig more in the thrombocytopenia.